You're in the shower or getting dressed, and your hand brushes over something that wasn't there before. A small bump, your arm, your back, maybe your neck. Maybe you only feel it for half a second before you move on with your morning. And in that half second before your brain catches up, one question flashes through. Is this something? If that's ever happened to you, stick around, because in the next few minutes, you're going to know exactly how to answer that question every single time for the rest of your life. Here's the promise. There are only 7 kinds of bumps that commonly show up on skin after 60. Almost everything you'll ever find fits one of them, and there are only 5 letters. 5 that tell you when something's actually worth a phone call. That's it. That's the whole system dermatologists spend years training to use, broken down into something you can actually remember. By the end of this video, you'll have it too. No medical degree required, just your own 2 hands, a few minutes a month, and a little bit of know-how. So let's start with the 7. Let's start with why this happens more as we age. Your skin isn't just a covering, it's the largest organ you have. And like every other organ, it changes over the decades. Oil glands can enlarge, fatty tissue can shift and clump. Old sun damage from your 20s and 30s can quietly resurface 40 years later. Blood vessels near the surface can dilate. None of this means your skin is failing you. It means it's been working for 60, 70, 80 years, and it's showing its history the way an old, well-loved book shows its creases. With that in mind, here's the lineup you're about to learn. 1. The lipoma. Soft, doughy. Moves a little when you press it, almost like it's floating on a cushion underneath your skin. That's a lipoma, a small pocket of fat cells that's organized itself just under the surface. Painless, slow-growing, harmless. They can show up on the shoulders, the back, the arms, almost anywhere. The body stores a little extra padding. Doctors don't fully know why some people get them and others don't. Family history seems to play a role, but unless one's growing fast, pressing on a nerve, or bothering you cosmetically, the answer is almost always, leave it alone. 2. The epidermal cyst, sometimes called a sebaceous cyst. This one's firmer, more like a small pea sitting under the skin, and if you look closely, sometimes with a tiny dark dot at the center. A blocked pore, which is exactly where it started. These form when skin cells that should have shed instead get trapped beneath the surface and slowly build up over time. Usually harmless. But here's the one thing worth knowing. Unlike a lipoma, a cyst can occasionally get inflamed, red, and tender, especially if bacteria get in. If that happens, do not squeeze it. It rarely empties fully. It can push the infection deeper into the surrounding tissue, and it almost always makes the eventual removal by a doctor messier than it needed to be. If it bothers you enough to want it gone, a quick in-office procedure beats a bathroom mirror and good intentions every time. 3. Skin tags. The small, soft, often skin-colored flaps that show up wherever skin rubs against skin or against clothing. The neck, the armpits, under the chest, the eyelids. Extremely common after 60. Completely harmless, and they never turn into anything more serious. One odd fact worth knowing. Some research has linked them to insulin resistance and weight changes, not because the tag itself is dangerous, but because it can be a small, useful nudge to ask your doctor about blood sugar at your next visit. If one catches on jewelry or clothing and genuinely bothers you, they're simple for a doctor to remove during a routine office visit. 4. Seborrheic keratoses. Waxy, slightly raised, looks almost stuck on like a drop of candle wax or a scab that never quite falls off. Sometimes brown, sometimes black. And here's a stat that tends to surprise people. This is the single most common benign skin growth in people over 60. Nearly everyone develops at least one by this stage of life, and plenty of people have dozens, scattered across the shoulders, chest, and back. They can appear almost anywhere except the palms and soles, despite how they can look. And they sometimes look genuinely concerning to people seeing one for the first time. They are not cancerous, and they don't become cancerous. But hold that thought, because in a few minutes I'll show you exactly why people sometimes confuse them with something that does need attention, and why that confusion actually matters. 5. Cherry angiomas. Small, bright red or purplish dots, usually smooth and round, no bigger than a pencil eraser. They tend to appear on the trunk, chest, and arms as we get older. Just tiny clusters of blood vessels near the surface of quind. The skin, one of the most harmless things your body does with age. Nearly everyone accumulates more of these over time, the same way we accumulate freckles or age spots. No treatment is needed, ever, unless one happens to sit somewhere it keeps catching on clothing and bleeding. 6. Dermatofibromas. Small, firm, often brownish bumps, frequently found on the legs. Here's the party trick that identifies them instantly. Gently pinch the skin on either side, and the bump dimples inward, like a tiny button being pressed. If yours does that, you already have your answer. Some are thought to form after a minor injury, like a bug bite or a small cut. Though plenty of people don't recall any specific trigger at all, they're benign and typically just left alone. 7, and this one's a little different, so pay attention. The actinic keratoses. Rough sandpapery, often pink, red, or skin-colored, usually showing up on spots that got the most sun exposure over the decades. The face, the ears, the scalp if you're thinning up top, the backs of the hands, the forearms. A lot of people feel these before they ever see them, running a finger over the forearm and noticing a patch that feels like fine sandpaper weeks before they ever catch it in a mirror. This one gets called precancerous. And yes, that word is designed to get your attention. But here's the more accurate way to think about it. Only a small percentage ever progress into an actual skin cancer. And when they do, it's usually slow, playing out over years rather than weeks. Still, because they can occasionally develop into squamous cell carcinoma, dermatologists like to treat them when they're found, often with a simple freezing treatment that takes seconds, right there in the office. If you got a rough patch that's stuck around for months, mention it at your next checkup. Not urgent, just worth saying out loud. So 7 categories: lipomas, cysts, skin tags, seborrheic keratoses, cherry angiomas, dermatofibromas, actinic keratoses. If you've got a bump you've been quietly wondering about, there's a very good chance it just walked past you somewhere in that list. But now here's the part of this video that actually matters most. Because there's a smaller category of skin changes that doctors do want you to catch early. And the good news is, it's genuinely not complicated to check for. It comes down to 5 letters. A, B, C, D, E. A is for asymmetry. Take a spot and imagine drawing a line straight through the middle of it. In a normal mole or bump, both halves roughly match, like a mirror image of each other. In a concerning one, the two halves look different from each other, one side bigger, oddly shaped, or textured differently than the other. B is for border. Healthy moles tend to have a smooth, clearly defined edge, like someone drew it with a steady hand. A concerning spot often has a ragged, notched, or blurry border, almost like the edges are spilling outward unevenly instead of staying contained. C is for color. One even shade brown, tan, whatever it naturally is reassuring. Multiple colors within the same spot, especially if you see black, red, white, or blue mixed together, is worth having checked. D is for diameter. Doctors often use 6 millimeters, roughly the size of a pencil eraser, as a rough guide. But here's the detail almost nobody mentions. Size alone doesn't rule anything out. A spot can be smaller than that and still need attention if it has the other warning signs present. Diameter is one clue among 5, not a pass or fail test on its own, and it shouldn't be treated like one. And this is the one dermatologists say matters most is for evolving. Has a spot changed, grown, changed color or shape, started to itch, bleed, or crust over when it never did before? Any kind of change over weeks or months is the single strongest reason to get something checked, regardless of what it looks like otherwise. There's one more concept worth knowing, and dermatologists call it the ugly duckling sign. Most of us have a certain pattern to our moles and spots, a personal baseline that's unique to us. They can look dark, irregular, and stuck on, which can genuinely alarm someone seeing one for the first time. But now that you know the 5 letters and the ugly duckling sign, you have a real framework to tell the difference. Instead of just guessing and quietly worrying about it for weeks, it's also worth knowing that melanoma isn't the only skin cancer to watch for, even though it gets most of the attention in headlines and awareness campaigns. Basal cell carcinoma and squamous cell carcinoma are actually far more common and far less deadly when found early, but they don't always look like a classic mole at all. Basal cell carcinoma often shows up as a small, pearly, or waxy bump, sometimes with tiny visible blood vessels running through it, or as a sore that seems to heal and then reopens over and over in exactly the same spot. Squamous cell carcinoma tends to look more like a firm, red, scaly patch or a wart-like growth that doesn't resolve on its own, often on sun-exposed areas like the ears, lips, or the backs of the hands. Neither one needs to fit the ABCDE pattern to matter. The common thread across all three types of skin cancer isn't a specific look, it's persistence. A spot that won't heal, won't settle down, or keeps changing is the signal. Now, it's worth being honest about something here, because this video should build your confidence, not your fear. The overwhelming majority of skin changes people notice, the overwhelming majority turn out to be one of those 7 harmless categories we just walked through. Skin cancer, including melanoma, is highly treatable when it's caught early. And early detection starts with exactly what you're doing right now, paying attention and building a little bit of real knowledge instead of relying on guesswork. It's also worth understanding, honestly, that not everyone carries the same level of risk when it comes to the small minority of spots that do need attention. If you have fair skin that burns easily, light-colored eyes, a history of blistering sunburns, especially if some of those happened decades ago, before sunscreen was part of everyday life, or a family member who's had melanoma, your baseline risk is somewhat higher than average. So is spending years in an outdoor job or hobby. Farming, construction, golf, gardening, boating, anything that put you under the sun for hours at a stretch, year after year. None of this means something bad is coming. It simply means these self-checks are worth taking a little more seriously. If any of that describes you, the same way someone with a family history of heart disease pays closer attention to their blood pressure. Everyone benefits from the monthly habit we're about to walk through, but if you fall into one of these higher risk groups, it's worth mentioning that history to your doctor so they can help you decide how often a professional skin check makes sense for you specifically. This isn't about scanning your body every day looking for danger. It's about doing one simple thing on a regular basis and then getting back to your life. Once a month, in good lighting, take a few minutes to look over your skin. A full-length mirror helps, and a hand mirror for the spots on your back or scalp that are hard to see. Or better yet, ask a spouse, partner, or family member to take a quick look at the areas you simply can't see on your own. It sounds like a small ask, but those hard-to-reach spots, the middle of the back of the scalp, are exactly where things can go unnoticed the longest, sometimes for years at a time. Work through your body in a consistent order so you don't skip anything. Face and scalp, ears and neck, chest and torso, arms and hands including between the fingers and under the nails. Then legs and feet, including the soles and between the toes, which are surprisingly easy to forget entirely. Some people find it useful to take a photo with their phone every few months, so there's a record to compare against. Later memory alone can be unreliable for something as gradual as a slowly changing mole. If you take photos, a simple habit is to snap the same few areas each time in the same lighting. So comparisons are actually meaningful rather than guesswork dressed up as a system. If you find a new bump, run it through what you learned today. Is it soft and slow growing, like a lipoma, firm with a tiny central dot, like a cyst, a waxy stuck-on patch, like a seborrheic keratosis? If it fits comfortably into one of those familiar patterns and it isn't changing, that's reassuring, and it's completely reasonable to simply keep an eye on it and move on. But if something is new and doesn't fit a familiar pattern, if it's asymmetrical, has an irregular border, shows multiple colors, is growing, or is simply the odd one out compared to everything else on your skin, that's not a moment for worry, it's a moment for a phone call. A dermatologist can typically look at a spot and know within moments whether it needs a biopsy or whether it's nothing to think twice about. That single appointment, that 10-minute conversation, is often the entire difference between an early, simple treatment and something far more serious down the road. It's also worth knowing what actually happens if you do go in with a spot that concerns you, because for a lot of people, the fear of the unknown is genuinely bigger than the appointment itself. A dermatologist will typically start simply looking at the spot, sometimes with a handheld magnifying tool called a dermatoscope that lets them see patterns in the skin invisible to the naked eye. In many cases, that's enough for them to reassure you on the spot, right then and there. If something looks like it needs a closer look, the next step is usually a biopsy, which sounds far more dramatic than it actually is. A small sample of skin, sometimes just a shave of the surface, is removed under local numbing medication. Right there in the office, in a matter of minutes, it's sent to a lab and results typically come back within a week or two. Most biopsies come back benign, and if one doesn't, catching it at that biopsy stage, rather than waiting months or years while it sits in the back of your mind, is precisely what keeps early skin cancer among the most treatable cancers there, with survival rates for early-stage melanoma exceeding 98%. The entire process, start to finish, is far less invasive than most people brace themselves for. One more thing worth mentioning, because it comes up so often at this age, not every bump you find is even on the skin's surface, in the way we've been discussing. Sometimes what people feel is a swollen lymph node, particularly in the neck, underarm, or groin, often linked to a recent infection like a cold or a minor cut nearby. These are usually soft to firm, sometimes a little tender, and they tend to shrink back down within a couple of weeks as the underlying issue resolves on its own. If a lump like that doesn't go down after a few weeks, or keeps growing, instead, that's also worth a doctor's visit, not because it's likely to be serious, but because checking it costs you almost nothing, and peace of mind is worth the 10 minutes it takes. And if you're on blood thinners, or you have diabetes, it's worth mentioning any new or changing bump to your doctor a little sooner rather than later, simply because both of those conditions can affect how your skin heals and how infections behave underneath the surface. It doesn't mean the bump itself is more likely to be serious. It just means your care team may want to keep a slightly closer eye on it together with you. If there's one thing to take from everything we've covered today, it's this. Your skin has been with you for decades, and the marks it's picked up along the way are mostly just evidence of a life well lived. Lipomas, cysts, skin tags, seborrheic keratoses, cherry angiomas, dermatofibromas, actinic keratoses. These are the normal, sometimes mildly attention-needing souvenirs of getting older. And the vast majority of them don't need to steal your peace of mind, but now you also know the 5 letters that matter, the ugly duckling sign, and the one question, is it changing, that outweighs almost everything else you could ask about a spot on your skin. Knowing the difference isn't about living in fear of your own body. It's about giving yourself the tools to notice the rare thing that matters, quickly, calmly, and without drama, so you can spend the rest of your time simply living, without worry hanging over you every time you catch a glimpse of yourself in the mirror. So do one thing this week, tonight even. Take 2 minutes and actually check. Start at your scalp, work your way down, and don't skip the spots that are hard to reach. Not because you should be scared, but because 2 minutes of looking once a month for the rest of your life is one of the easiest gifts you can give the people who love having you around for a long time to come.